In this week's muscle breakdown, I'm going to be covering a very important muscle of the rotator cuff group, specifically the only muscle that stabilizes the shoulder from the front, the subscapularis. What's up, everybody? Dr. Matt Maggio here, creator of the 𝐓𝐡𝐞 method and founder of the soft tissue revolution, where we show massage therapists how to easily make well over $100,000 a year, all while working less than 20 hours per week by learning to work smarter, not harder. Back at it for muscle breakdown. This week I'm going to be covering a very important muscle when it comes to overall functioning of the shoulder, stability, resolving injuries, pain, dysfunction, everything you can list. The subscapularis muscle. Now, the subscapularis muscle is very important in overall functioning. One of the main jobs that it does, it's classically considered an internal rotator of the shoulder, and it's really the only muscle that stabilizes the shoulder from the front. And it does tend to get a lot of dysfunction in it. The problem that I see is that so many practitioners, they want to get really focused on one thing. One thing is going to cause the problem and that must be it. And the subscap has been one of those muscles over the years where they're like, hey, if you treat the subscap, it's going to fix all these shoulder problems. Yes, the subscap does need treatment, but you also need to look at it in conjunction with other muscles in the rotator cuff, specifically the 𝘓𝑢𝑚𝑜𝑟𝑝ℎ𝑢𝑠 teres minor. And I do a lot of work in the posterior joint capsule of the shoulder as well. Now, treatment and palpation of the subscap, and I'm going to be honest here, I'd say 95 to 98% of practitioners are not palpating it effectively, and they're sure as hell not treating it effectively, because if you can't palpate it effectively, you can't treat it effectively. And a lot of times, practitioners are going in there thinking that they're treating the subscap, but what they're really treating is the lat or the teres major. They also think because it hurts like hell and it's excruciating for the client, they must be doing something good. And the client's like, yeah, it hurts like hell. You must be doing something good. No, bullshit. You're not doing anything good. In order to break down dysfunction in a muscle, specifically what I call scar tissue is like glue that gets inside the muscle, makes it hard for it to stretch and contract. You need proper depth, then tension. You don't need a lot of tension. And what I find is that people, first off, can't find the muscle, and if you can't find it, you can't fix it. And then secondarily, they get way too much compression because that muscle is very thin and it sits on the top of the front part of that shoulder blade, and it is dysfunctional in a lot of shoulder problems. I tend to see this more in people that are overhead athletes, have a lot of history of dislocations, separations, just overall athletes as well. Usually what I find is the majority of the shoulder function starts in the 𝘓𝑢𝑚𝑜𝑟𝑝ℎ𝑢𝑠, so clearing that up, then subscap. The subscap isn't going to be that one hitter. So I always say, you can't fix a problem if you don't know what it is in the first place, and if you can't find it, you can't fix it. So what I want to include this week in our muscle breakdown is an advanced palpation of the subscapularis muscle from one of our training modules in the 𝐓𝐡𝐞 method. So I'm going to include that this week, and you'll see how slow, how deliberate, how I use landmarks, how I don't put myself in a rush to find the muscle and just slow down. To go fast, you must learn to go slow first. So check that video out. Now, once we've cleaned up the capsule and we've cleaned up the 𝘓𝑢𝑚𝑜𝑟𝑝ℎ𝑢𝑠, now we need to get in there and clean up the subscap. And you got to make sure you watch the video over and over again about the palpation of this subscap and being very precise, because if you're off just a little bit, you're going to be on the nerve, you're going to be on the lat, it's going to hurt like hell for the client, and you're not going to get an effective treatment. So the way we want to look at this is essentially, if the shoulder is sitting like that and you're going to come in through that, the subscap sits on the top of that. And what happens is, a lot of people, it's very similar to the 𝘓𝑢𝑚𝑜𝑟𝑝ℎ𝑢𝑠 where there's not a lot of tissue in there. So you want to get it just right. And I like to do this with the client laying on their back. So you always want to use some lotion. Lotion is going to really help because it's a very sensitive area. What you would want to do is get your table up as high as possible as you can, because that's going to help you with your body mechanics. Now the key is actually the positioning. So what you're going to do is have the client scoot their body over a little bit, and that's going to get everything to open up. Get a little bit of lotion in there to open that up. Make sure you watch the advanced palpation of the subscap. If you don't watch that and get this right, you try the treatment before, it's going to be very counterproductive. Now the key is going to be in the motion. So once we get in there and we find the area that needs the treatment, what we do is we start it in a very shortened position, and then the first thing we're going to do is get this arm to open up and come back. That's our first motion. That's the motions we always want to get on the shoulder, is bringing this arm back, because if we don't get that, it doesn't matter what the other motions are. So the key here is your body position. So we want to approach it like a 45-degree angle, very similar to what we talked about with the infraspinatus. So the motion here is I'm going to be lined up just like that. And as we go in, that allows me to sink in on that subscap. Then I back out. I've already done the palpation. I've already found all that. And then I'm going to put that muscle in that shortened position. And my depth is going to be just a very slight drop in with my body weight, maybe about 4 or 5 ounces of pressure. And then my tension is going to be a lean straight across. And that's loaded up. And we're going to put in a little more shortened position. And what you're going to do is slowly start to drop that in just like that. And you're going to go very slow, very precise. When you feel it start to pull, now you're going to shift your body around and you want a traction with that. And you're not in a rush. You're getting that to open up. You're leaning in with more of that tension.
Body mechanics.
You want to continue to go slow. We talk about this. To go fast, you have to go slow first, and you don't need to be in a rush in here. Now, the mechanics are very important. The first thing is you're going to line up, and you're going to sink in just like that. Going to back out, and your depth is going to be just a very slight elbow drop to the floor. That's all you need. And then your tension is going to be a little bit of a lean. That's loaded up. You're going to start to move the arm. About 25%. You're going to feel that, and then when it starts to pull, you're going to shift your body and go just like that. It should not be painful. It should not be excruciating. If it is, you did not watch the advanced palpation video. This is very important for an effective shoulder treatment and resolution of the shoulder problem, but you got to get your body mechanics right. So you're going to practice kind of going in here with that, stepping and going just like that. And that's where it comes from, the setup and getting the setup correct. Because if your setup isn't correct, you're not going to get an effective treatment. So I hope you enjoyed that video. A couple take homes here. First off is slowing down and palpating. Don't be in a rush. You know, so many soft tissue practitioners just want to get in there and treat right away. Slow down. Find the landmarks. Find where that dysfunction is and do a more effective treatment. You know, so many practitioners do what I call shotgun treatment, where they just treat a bunch of shit and kind of see what happens. We like to teach in the peak method what's called a sniper approach, where we slow down, we get it just right, and we go in and find that dysfunction and get it. Treatment should not be excruciating. I say to my clients it should be a hurts but good, like nothing too excruciating. So if your clients are wincing, they're like flopping around on the table, your palpation's shitty, you're too compressive, and you're probably not even on the muscle. So hope you guys enjoyed that video. If you like it, give it a comment, a share, drop anything, muscles or specific things you want us to cover. And lastly, grab my free training. All the information is down there, and I'll see you guys on the next one. Bye.